So I want to give credit to Mariano Menendez, who was supposed to present this, but he did make these slides and fortunately got them to me in time so I could review them. So if you don't like them, blame him. So the first question you might ask is, what is a functional somatic syndrome? Which is a very legitimate question. Let's see here. All right. So functional somatic syndromes. There's several related syndromes that are characterized more by symptoms, suffering, and disability than by disease-specific demonstrable abnormalities of structure or function. So you still might be asking, what are functional somatic syndromes? These are common things that we see: fibromyalgia, irritable bowel syndromes, chronic headaches, chronic fatigue syndrome. And these are things that when you see in a patient, you might wonder if their outcome is going to be different or not as good. Why should we care about this? Well, we know it causes great disability to a lot of patients. There's actually a lot of literature on this, and that it actually costs a lot more money to take care of these patients in the hospital with congestive heart failure, total hips, total knees, but nothing's been done in total shoulder arthroplasty. But before you ask the question of how do you look at this, there's this notion that functional somatic syndromes is just one syndrome, and they have different amounts of disability. So for instance, you might have fibromyalgia and have fewer symptoms and less disability, or fibromyalgia, TMJ, irritable bowel syndrome, and have more disability and more symptoms. So the study purpose here was to determine the prevalence of FSS in patient undergoing elective arthroplasty and characterize the association with outcomes and costs. So this was a retrospective study of prospectively collected data. This is my registry, essentially. Inclusion criteria is anatomic and reverse shoulder arthroplasty. I started this in February 2015 using REDCap at that time, then OBERD, and we used 2-year follow-up data. I have about 75% follow-up. We always try and get 75% follow-up in the data, so it's a high percentage follow-up. Exclusion criteria were revision arthroplasty and fractures. And to make this more simple, we just isolated 4 different functional somatic syndromes: fibromyalgia, irritable bowel syndrome, chronic headaches, and chronic low back pain. In the registry, I collect ASES, SANE, VAS, and all scores were measured 2 years postoperatively. In addition, cost. We use time-driven activity-based costing, which is a very granular way of looking at cost. It really is the gold standard, and we have a way of doing this, and we've written about this in other papers. So we looked at high-cost patients, which we defined as costing greater than 75th percentile of cost compared to less than 75th percentile. So when you look at the results, we had 82 patients, 17% of 480 patients who had functional somatic syndrome. We use the 398 as the control. And when you look at ASES scores, they had a 10-point less ASES score if they had functional somatic syndrome. They had an 8-point difference in their SANE score, and they had more than 1 point higher in their pain score, VS pain score. This is the money slide here, though. It's really fascinating. The more functional somatic disorders you have, it indirectly correlates with your ASES and SANE scores, and it's pretty powerful with how much it predicts this. Pain intensity also at 2 years directly goes up with the more you have in terms of functional somatic disorders. And the amount of cost directly goes up when you look at TDABC. So this is a very real thing that costs money and leads to more disability in shoulder arthroplasty if they have more of these. So conclusions: FSS, or functional somatic syndromes, are common in shoulder arthroplasty, upwards of 20% of patients, and they strongly correlate with suboptimal outcomes, as you might expect. The strength of the association well surpassed other predictors of poor outcomes, prior shoulder surgery and chronic opioid use. And we should really think of these as a spectrum of disease. It's not just fibromyalgia, not just TMJ, but a spectrum of disease. And we're beginning to do some of this. We haven't done it quite yet, but really consider perioperative identification and optimization, counseling that you're not going to have as good of an outcome. And we really need to better understand this large group of patients in our arthroplasty population. Thank you.